Labdien!
Good morning. I think we can begin. Thank you very much for coming at this press conference, which is devoted to our high-level discussions about tuberculosis and multi-resistance of tuberculosis. And we are going to have 4 speakers. First, an address by the Latvian Minister for Healthcare, Guntis Bilevich, then the address by the European Regional Director of World Health Organization, Madam Susanne Jakob. The next address by the representative, Mr. John Ryan, and then an activist for the Global Alliance of Fight Against Tuberculosis, Timur Abdullayev. Now the word to Mr. Guntis Bilevich. Dear representatives of the media, today it is already the 2nd day when, in the framework of the Latvian presidency of the European Union, we are hosting the high-level conference with the aim to limit the spread of TB in the European Union, in the European Economic Area, and in the countries of the Eastern Partnership. The main priority of the European region is to limit the spread of MDR-TB. Currently, the highest proportion of MDR-TB is found in the European region, and its treatment creates a great burden for the health sector. Currently, in Latvia, the incident rate for TB is 38.8 cases on 100,000 inhabitants. However, we are full of commitment to decrease the incident rate in order to achieve the European average. That is 20 cases for 100,000 inhabitants. Therefore, we would be no longer on the list of the countries with high tuberculosis incident rate. Last week, I presented the Latvian society with my vision of the improvement of public health in Latvia. That includes the decrease of TB incident rate. Getting infected with TB largely depends on the human capacity to resist the infection. And this is why, in order to combat this infection, it is very important to maintain a healthy lifestyle. This means healthy nutrition, active lifestyle, not smoking, not drinking, not taking dependency-inducing substances. These are the prerequisites to decrease the risk to become infected and sick. In order to uncover the disease in a timely fashion, it is important to regularly visit your doctor and follow medical checkups. Therefore, it is very important to create an understanding of the importance of health, and this has to be done from a very young age. So I think that we have to cooperate with the Ministry of Education and Science, and we have achieved an agreement. So we are going to include health science as an official part of our curriculum in the country. Today, in conclusion of our conference, we are going to approve the Riga Declaration, which will mean that we are taking on the responsibility to implement the World Health Organization strategy to decrease the incident rate of TB by 50% in 2025, and to decrease the mortality rate from TB by 75%. At the same time, we are taking on the commitment to ensure sustainable approach for tuberculosis control and use of resources in accordance with World Health Organization strategy. We will also implement new innovations and ensure transversal multisectoral cooperation with risk groups and ensure international cooperation to decrease the spread of TB in Latvia and the European Union. Now the word to Mr. John Ryan. Thank you.
Very much. Good morning, ladies and gentlemen. First of all, let me say that we have just published the joint report with the ECDC on the status of tuberculosis in the European region in up to 2015. And this is a report that covers the whole WHO European region with all the 53 countries. Let me start with the good news. The good news is that the European region has made good progress in the last decade, and in the last decade in particular, to reduce the incidence of TB in the region, and TB has been falling by 4.5% every year. And this is really a good news, and we can be proud of this. This is just enough for the European region to reach the Millennium Development Goal by the end of 2015. However, the bad news is that this is not enough to eliminate TB in our lifetime, which is our objective, which is our aim, which is our target. If you look at the figures, the situation is still quite bad in our region, because every day there are 1,000 new cases of TB, and we lose 38,000 people unnecessarily to TB in a year. It's also important to note that TB is the leading cause of death among people who live with HIV/AIDS, and this deadly combination is increasing. And TB also makes it more difficult to treat people with other chronic conditions like diabetes. The European region is the region which is most affected in the entire world with multi-drug resistant tuberculosis. And this is the form of TB that is not curable with the first-line antibiotics, but need much longer and more expensive treatment, and sometimes it is not curable. And unfortunately, 85% of all the new TB cases in our region are in the so-called 18 high-priority countries, most of them in Central and Eastern Europe, but 5 of these are in the European Union. Let me also say once more that only half of all the MDR TB cases are detected in our region, although there has been an increase in this in the last year, which is very positive. And only half of those who are detected are successfully treated. So this means 1 in 4. MDR TB poses a serious burden to patients and their families because the treatment lasts for 2 years, and it can have serious side effects, and this is not acceptable. So this calls for scaling up the access to safe, rational, and efficient new TB drugs, as well as innovations and rapid diagnosis and care centered on the needs of the patients. In the last year, the good thing is that 2 new medicines were introduced. For a long time, there were no new medicines because TB was considered as an orphan disease, but last year 2 new medicines, and that's great. But we need much more research and development, and here I would like to thank to the European Union colleagues for all the work that they have done in this very important area. To eliminate TB in our lifetime, we have to go much further in 3 areas. One area is to further intensify research and innovation. The second one is the integrated patient-centered TB care and prevention for all who need it. And the third one is the bold policies and supportive systems in order to reach this elimination target. And these are the 3 major areas in the End TB strategy that hopefully the World Health Assembly will adopt in the upcoming assembly in May in 2015. And the European region's action plan that we are also renewing is based on this global NTB strategy, but it is also based on the excellent experience and lessons learned from the work of the last 4 or 5 years with the previous action plan. So all in all, I would like to say that we are on the right track, but Europe is also in the position to pave the way for TB elimination in the world. Europe has always been leading on research, development, and innovations. We have to continue this. We have been leading also in many ways on health system strengthening. We continue to keep this flagship. And we have been leading also in many ways in partnerships, and this is a very important reason why success has been achieved in our region. This work has to continue, and we count on all your support. Thank you.
Paldies, Jākabas kundzei. Tagad vārds lūdzu Rainkungam. And now the floor is given to Mr. Ryan.
I'd like to open by thanking the Latvian presidency and particularly the Minister for the initiative of putting tuberculosis on the agenda of today's conference. Secondly, on behalf of the European Commission, I'd like to thank and congratulate the World Health Organization for their very strong leadership, and Susanna Jakob here has shown this leadership in the area of elimination of tuberculosis. The European Commission and the World Health Organization are cooperating very closely in this field, particularly in the area of surveillance, and we've heard that recently a joint surveillance report was published between the European Centre for Disease Prevention and Control and the World Health Organization, covering the entire European region. Thirdly, I'd like to stress the close cooperation and support which we think is essential with civil society, and particularly with the Stop TB partnership. Civil society is a crucial partner for the Commission and plays a very important role in political awareness raising, in monitoring the situation on the ground, and in the development and implementation of policies and concrete actions. And last but not least, I'd like to mark here the contribution of the Global Fund to fight HIV, tuberculosis and malaria, which is an important partner and actor in the fight against tuberculosis. The fight against tuberculosis in the European Union is extremely complex. On the one side, several member states, such as the Baltic countries, Romania and Bulgaria and Portugal, face a very high disease burden. And on the other side, there are a majority of member states with a lower disease burden, where new cases are concentrated in large urban areas and within vulnerable populations, such as the homeless, in the prison system, and in people with alcohol and drug addictions. We're therefore facing severe health inequalities between countries, but also within countries, between different social groups. And our response, therefore, needs to take into account this situation and needs to be adapted to the specific circumstances of each country. High incidence countries need to scale up their prevention and treatment activities and to ensure an adequate reach beyond centralised treatment services, while low incidence countries need to focus on particular risk groups and hard-to-reach populations. The European Commission is committed to providing support to all of its member states in addressing the challenge of tuberculosis, and also through our various mechanisms in supporting our neighbouring countries. For example, the health programme has provided several ongoing actions which were showcased here in a workshop yesterday, and new actions will be launched soon, particularly bringing the member states together to look at co-infections with HIV. Secondly, the European Centre for Disease Prevention and Control provides general scientific guidance and expert opinions, and also technical assistance to specific member states if requested. And thirdly, as Susanna Jakob has said, the research programme has heavily invested in the development of new products and new pharmaceutical products in particular. Under the former research programme, 118 million euros was invested. Under the new research programme, which has just begun, we have 2 new vaccine projects worth 26 million euros which have been launched. The Commission is also offering support to member states which have difficulty in obtaining or procuring certain medical countermeasures in the fight against tuberculosis. We have a new mechanism which is called the Joint Procurement Agreement, which is now operational and allows a minimum of 4 member states to jointly purchase medical countermeasures together, and we're already starting this mechanism as we speak. And in closing, let me repeat that the Commission is committed to working jointly with member states, with neighbouring countries, with the World Health Organization and with civil society to address and eliminate tuberculosis as a public health threat by 2050. And we congratulate the Presidency and other partners in having developed the Riga declaration, which we think will formulate a very solid foundation for future work in this area. Thank you.
We would like to thank you, Mr. Ryan, and now the floor is given to Timur Abdullayev.
Thank you very much. Good morning, everyone. I would like to first of all say that it's my great pleasure to be here on behalf of civil societies and communities of people affected by TB. Several years ago, it would be something incredible for civil societies to be so intensively involved in organization of an event like this. So I would like to thank Minister. I would like to express my sincere gratitude for this happening today. And the fact that I'm here sitting with you is also, it says a lot. And I have to say that civil societies were not just tokenistically represented here. In fact, TB Europe Coalition and its partners were involved in organizing this event at every single step, starting from the planning. And today, I've seen many colleagues of mine actually listening to the statement of the civil society organizations. Actually, they contributed to this statement being developed. And at the end of my short intervention here, I would like to give a quote from that civil society statement, just to emphasize how important it is. I would like to say that TB used to be a purely medical problem. It was considered to be a disease that has to be dealt by doctors. This is changing now, and this has to change even further. TB is not just a medical issue. It is a human rights issue. It is a social issue. And we never can stop TB. We can never put an end to TB without responding comprehensively. We have to, in addition to treatment and prevention in a medical sense, we have to put specific efforts to ensure that there is social support, that human rights of people affected by TB are protected, and also to make sure that people who have TB, in addition to medical interventions, medical support they are receiving, they also need to have the social support and psychological support, especially in context of MDR-TB. It's incredible how difficult it is for patients to struggle the disease. It's incredible how long the treatment may be, how difficult it may be, and what kind of side effects people may face. So in this situation, people need to be supported not just by doctors. They also need to be supported by other ex-patients. They need to be supported by civil societies. And they need, of course, to get psychological support. I would also like to say that it's very important to remember that in response to TB epidemic and MDR-TB epidemic, civil society plays a crucial role. We know that TB is disease which can affect everyone, but there are populations which are most hardly affected by the disease. And these populations may be hard to reach for the usual ways for public health institutions. These populations may include migrants, these populations may include people who use drugs, and other vulnerable communities who may be marginalized, sometimes criminalized, and may avoid the contact with the public health system. So I would say that it's really crucial that in Riga Declaration, the role of civil societies and communities is stressed. I can say how much I'm happy to see that Riga Declaration really represents a comprehensive approach to responding to TB and MDR-TB epidemics. At the end, I would like to say, as promised, to give a quote from the civil society statement which was read just before this press conference. So, civil society would like to call on those countries hardest hit by TB, MDR-TB, and HIV in the region to reform health and financing systems to allow smooth transition to patient-centered TB care with special consideration for affected communities, to urgently develop clear plans for sustainable TB and financing and HIV financing and scale up beyond current donor funding, and to continue engagement with civil society and affected communities to ensure sustainability and accountability of programs. With this, I would like to end, and thank you very much.
Thank you to Mr. Belevich. Now I would like to give provide several sentences Mrs. Jacob mentioned, and the Mr. Abdullahi also mentioned that every person can be subject to tuberculosis. I have two positions. I'm the Member of Parliament of Latvian Republic as well as a Minister of Healthcare. Last week I underwent tuberculosis examination to display and illustrate example to members of the parliament as pulmonary tuberculosis case was reported among technical personnel of the parliament having contact with majority of people working at the parliament building. And so tuberculosis can hit every person, and today, tuberculosis vaccine will be ended and ceased by next month for children. Unfortunately, we haven't succeeded in buying and procuring that vaccine, but I really hope that we will succeed in that by support by Dr. Jacob as a company. Producing that vaccine in Denmark are not capable of doing that due to technical reasons. Thank you so much. So now there is time for questions.
Okay. Peter O'Donnell, European Voice in Brussels. I'd like each of you to try and explain to me what the Riga Declaration means when it says, I haven't got the exact quote in front of me, but the final whereas and so on says something about promoting the use of better quality intervention and so on. Taking account, it says, of cost effectiveness. What does this mean, taking account of cost effectiveness? Can you explain to me, please, what that alludes to? Have you not got it in front of you? I can find the damn thing. I mean, you're supposed to be signing off on it in 10 minutes, so I don't know why you don't know what's in it. But it's the final paragraph there. Here we go. It says, recognizing the need to scale up investment in TB research and innovation for new tools and approaches to fight TB and MDR-TB, which is perfectly understandable. But then it says to take into account cost effectiveness. I don't understand what that means, what it contributes to the discussion. Since it's your declaration, I'd like to know what it is you meant by it.
O'Donnell kungs, vai tas ir jautājums man?
So, Mr. O'Donnell, would it be the question to the Minister of Healthcare? I will try to answer your question, Mr. O'Donnell. So there is a certain part paid for, so what does the treatment of a TB patient cost? Those are several dozens of thousands of euro. Simultaneously, if patient has MDR-TB, this treatment would cost tenfold, 160,000 euros or even more. Whereas if a patient has developed XDR-TB, so the treatment would cost about 500,000 euros. And those figures prove the fact that taking into consideration that tuberculosis is spreading, it's a contagious disease, and pulmonary tuberculosis TB patient could breathe out, so that between 5 to 10 people would develop TB as well. And following those figures, we see that tuberculosis treatment, TB treatment, especially of MDR-TB treatment, are extremely expensive, and our goal is to cut those numbers of reported cases as much as possible and as fast as possible. So that would be included in that wording of cost efficiency. So I have the question to Dr. Jacobs.
New models of care. That's very important, and we have to move out the TB control from the hospitals to the ambulatory care to primary health care, have an integrated approach to ensure that we have an uninterrupted treatment of the TB patients, which do not lead automatically to MDR-TB. So that's what is the sense, and I think these two things go very well in hand.
Basically, the idea is...
Exactly.
And as a civil society voice, I can add that, you know, we don't want money to be wasted on something that doesn't work or does not work effectively enough. So to me, everything has to be very cost effective. Otherwise, we're wasting resources, which we do not have enough.
Mums vēl ir iespēja vienam jautājumam, lūdzu.
So now we have an opportunity for another question. So I have a question to Mr. Ryan or Mrs. Jacob. Yesterday and today during the conference, you mentioned that new vaccine, anti-TB vaccines are undergoing. So what the progress currently is in those two projects?
I mentioned that the research program had invested in the development of new TB treatments. These are ongoing projects, so the work is being done at the moment by the relevant project partners. Afterwards, of course, there is the process of the clinical trials and the authorization of the new products. So you're not talking about new products on the market in the immediate future, but you're talking about a development chain for producing new products. I would say that before any new products would be on the market and approved, you're talking a minimum of 5 years. So we heard as well from our colleagues from the pharmaceutical industry in the last workshop of the fact that the efforts which had been made on antimicrobial resistance were now beginning to bear fruit. And I think the investments which are made by the Innovative Medicines Initiative at the European Union level, which is co-financed by the private sector and also by the European Union, is an example of how these new products can be developed over time with other international partners. Because in the area of antimicrobial resistance, for example, Europe is not working alone, but is working with partners in the United States. So we hope that by continuing the investment into the development of new drugs and new products, we will make available treatments in the medium to long term. But I agree with what the Minister and what Susanna Jakob were saying earlier on, that it's very important to look at co-infections. It's very important to address prevention in vulnerable groups at the same time as we approach the development of new treatments.
Not on this one, but I don't want to leave this room without thanking the Minister, Minister Belevic, for organizing this really very important and ground-breaking event that we have today, and also congratulate him for the excellent outcome document. And what I would like to promise from the side of WHO is that now, as we develop our action plan for the next 5 years, we will pick up the key salient points from the declaration and make sure that there is follow-up and implementation. And thank you again, Mr. Minister.
Liels paldies, ar to arī.
Thank you so much. Now the press conference is considered to be completed. Thank you.